I hope you're safe and comfortable at home or someplace where you can just relax and enjoy our time together. I can tell you, as I just mentioned, it's a new world for all of us, but I really felt it was important for me to continue our educational series. Every spring we have a wonderful June event, and it's just a big old party. We have music and we have entertainment and we have great food. I also do mini consults and sometimes give lectures, but really it's just a time to gather and enjoy each other's company. So we're not going to be able to do that this year, not until we all feel safe and we have a vaccine to protect us from the coronavirus. So with that, I had the idea that we would have a series of webinar events meeting weekly over the next 5 weeks. Today, we're going to speak about Inject-Lift, and then you can reference our website, or you can reference the from the corner office note that I send every month as part of our newsletter from the practice. So just know that I miss you. I wish I could see you in person. I wish I can greet you and hug you and do all the things that I so enjoy doing and so enjoy about being a physician in this wonderful community in Marietta. So with that, what I'd like to do is I'm going to take you through a lecture that I've prepared just for today's event. And the intent is to sort of walk you through what I think about when I'm thinking about the Inject-Lift and thinking about what I'm trying to correct with injectable fillers. In general, the way I think about what I do and the techniques that I use are this. Injectable fillers and injectable neuromodulators like Botox are intended to non-surgically reshape faces. And facial shape is really the cornerstone of beauty, to be honest with you. There are many, many faces that as they age get a bit saggy, but if facial shape is maintained, a youthful beauty is inevitable. It's, in my opinion, the most powerful aesthetic intervention, and it's the most critical component of facial aesthetics, maintaining beautiful facial shape. So fillers replace lost fat and lost bone. The next issue is texture, skin texture, lines, wrinkles, sun damage. So sunlight creates a breakdown in our skin. We lose collagen and elastin, etc. And that is treated with lasers, typically. Laser light fixes sunlight damage. And then gravitational sagging, sagging neck, sagging eyelids. Sagging for me is fixed with surgery. So you have fillers for fat, lasers for lines, surgery for sagging. So in general, I never ask more of any one of those tools than they can deliver. The key to making someone look natural is don't try to do what a facelift needs to do with fillers, because you could potentially get some lifting, but you would have to overfill the face to such a degree that it would distort you. It would make you look unnatural. So each tool has a job. And when you choose the proper tool and ask it to do its job, if you approach it in an artistic manner, then it creates the kind of look that you're desiring. So today we're going to focus on non-surgical intervention. It's going to be injectable fillers, injectable Botox, and the way we can sort of shape faces. And with that, I'm going to share my screen now with you, and we're going to go through a PowerPoint presentation. And then at the end of the PowerPoint, we're going to open it up for questions. In the lowest portion of your screen, there's a Q&A section, and you can type in your questions. And I will try to get through as many of those as I can. Also, at the end of the presentation, I will be sharing with you the discount codes for injectable products, and we'll go through how that works at the very end of the lecture. So without any further ado, let us get started. So I'm going to share my screen with you. Hopefully you can all see that. I'm going to bring myself way down here. In fact, I'm going to close myself out so you won't be able to see me, because that's not really important. What is important is that you be able to see the screen. So I want to start by saying that all of the patients in this evening's presentation are my patients. All of the procedures presented were performed by me. In the interest of patient privacy, please do not photograph or video this presentation. Thanks. So we're going to speak this evening about the Injecta-Lift, which is a non-surgical facial reshaping and rejuvenation technique. As I've defined it, the Inject-Lift procedure elevates non-surgical facial reshaping and rejuvenation to optimize facial balance and symmetry, creating a natural, more beautiful appearance with results that can last for many years before a touch-up is required. Now, having said that, everyone is different. For me personally, when I use fillers in my face, I'm usually doing a touch-up about every 27 months. There are some that get longer. There are some that get shorter periods of time. But on average, a couple of years for sure before we're doing touch-ups. Having said that, the more mobile portions of the face, like the lips, really can only get 6 to 12 months before a touch-up is required. But for the quieter parts of the face, the mid-face, the temples, under the eyes, even the jawline and the nose, results can last for a long time, and we're going to look at some of those patients. So I have two assistants. Jennifer Lichty is a nurse practitioner, and Kelly Humond is a physician assistant. They're both certified injectors and certified in the Inject-Lift technique. They've both trained under me personally. Jennifer practices at our West Cobb location as well as our main location in Marietta. And Kelly is exclusively at the West Cobb location, and I am exclusively at the Marietta location. So, artist, one who professes and practices an imaginative art, a skilled performer, one who is adept at something. I will tell you that people come in all the time saying, oh, I had fillers and they just didn't work for me, or they didn't look right, or I looked not like myself. Remember, it's not the filler, it's the one filling. It's not the painter, I'm sorry, it's the painter, it's not the paintbrush. It's not the filler, it's the person filling. An illusionist, a person who performs tricks that deceive the eye, a magician. Beauty, a combination of qualities such as shape, color, or form that pleases the aesthetic senses, especially the sight. So, at its best, facial plastic surgery uses artistic illusion to create beauty and self-confidence. And I think the next patient, which I'm sure many of you have seen, displays that about as well as you can in just picture form. This is a beautiful, outgoing expression, and that's the type of change that we love to create when we're doing facial rejuvenation. If we like the way we look, studies have shown that we invest in ourselves in a variety of ways, and this can add up to 7 years to our life, which is really quite dramatic. So it's not just the act of looking good, of course, it's the looking good and then wanting to do things to maintain that appearance, eating well, exercising, not smoking, wearing sun protection. Today, wearing a mask, all of these things will improve our life and extend our life. So why do faces age? Why do we look different as time passes? What changes? Well, we know, of course, that skin loses elastin, collagen, and hyaluronic acid, resulting in skin that is less snappy, thinner, and drier, all of which contribute to coarse texture, wrinkles, and sagging. Also, blotchy discoloration occurs due to sun damage to the melanocytes. This is not directly impacted by Injecta-Lift. This is not what my goals are. When fillers first were developed, we had collagen. Collagen was actually made from cow collagen by a protected herd of cows in California. And the original fillers were thought of as fine line treatments, but that's not what fillers are today. Fillers are shape. Fillers are fat replacements. Fillers are bone replacement. So that's really what fillers do. And to address skin changes, lasers and surgery are the things, and we will not be focusing on those today, but in future lectures we will. So repetitive facial muscle movement results in permanent skin lines and wrinkles. We all know that. The frown lines between our eyebrows, the furrows in our brow, the crow's feet, even lip lines, all represent areas where skin and muscle connect, so that when you move your muscle, the skin moves. And with chronic movement and over time a loss of elasticity, lines form in the skin. So if you can control facial muscle movement, that will inevitably relax facial lines. Facial fat diminishes and redistributes. It goes from up and out, up here in the cheek, with time sinking down and in, so that this volume here lived here. We lose volume in the lateral cheek. We lose volume under the eye. The cheek itself diminishes in volume, and the skin slides medially. And there's a fixed point. This nasolabial nose-lip crease is a stopping point. So the skin slides, and eventually this hill gets higher and the step off becomes more dramatic, and not shown here, but very often marionette lines form. Similarly, the skin slides and stops. So with that loss of lateral support, the cheek is going to slide. I think of the cheek as a pillow. When you take out stuffing from the pillow, with time, gravity will pull the fabric down. That's exactly what happens with our faces. So when someone comes and describes not liking this crease, this nasolabial crease, you really should not simply put filler here, because that's just adding volume to the central portion of our face, which is what aging does. Really, you need to laterally support. And by laterally supporting, you're repositioning the skin and soft tissues of the face, which will instantly make this line look softer. And by making this fuller, it makes the entire face look more youthful. So you're reestablishing that lateral support. And probably the last place that I fill on most faces is this smile line. Even though that's a very common complaint, the fix really starts up and out. And then, believe it or not, we lose facial bone as much as 20% from age 20 to 60, which results in facial shape change. And we'll talk more about that in a few minutes. So Injecta-Lift can affect bone loss, fat loss, as well as repetitive facial muscle movement. So Botox, we all know that Botox controls activity lines, but it does so much more. So here you see me injecting a patient for demonstration. Forehead lines. I'm talking in this picture about preserving some muscle in the lowest third of the brow. It's very important. If you completely quiet the forehead, the brow will drop. So we keep a little bit of motion. It also means that we can't treat the very lowest lines, but by staying up higher, we can soften the forehead movement and relax it enough where it looks better without jeopardizing brow position. Of course, we have furrows in the glabella. This area is called the glabella, those vertical number 11s, and that's what I'm treating here. Bunny lines in the nose. You see me treating what's called the lateral brow depressor to manipulate brow shape and position. Crow's feet, lip lines. I'm doing an injection down at the jaw to treat a fan-shaped muscle, which helps get the corner of the mouth up. the peach pit, sorry about that, the peach pit in the chin. And let's see how we can get rid of this. And another muscle, the DLI, also to help get the corner of the mouth up. So these are common injections when injecting with Botox. Sorry. Even in a young patient with activity, you can see the number 11. She's a beautiful woman. But if you start early when skin elasticity is really still quite preserved, as this woman demonstrates, the muscle movements are knocked out and there's no line whatsoever. And if she maintains her Botox starting as she did at an earlier age, she never will develop lines in this area. Now, for someone with deep lines in the forehead that are well formed, I did not expect, quite frankly, to get that degree of softening, but there's still a bit of a line. And I always tell people that lines are like scars. Once they're well formed and etched in the skin, they can only be softened but not eliminated. And I think this is a good example. They're still present, but much less dramatic. That also is true about her crow's feet. And of course, we've softened this area as well. So there's just a relaxed, but not overly done quality. And I want to point out that the brows are not dropped. In fact, I did something here where I tried to lift the brow a little by knocking out the depressor so that she's not as heavy in the corners of her eyes. But did you know that Botox can also keep eyes open when smiling? Some people get slit-like eyes when they smile, and sometimes it's just in one eye, and we'll look at that. It can also reduce a gummy smile. It can raise or lower eyebrows and narrow the lower face. So here's a good example. This eye closes down more than this eye, and you can see much more symmetric after Botox. And the Botox is placed right there at the edge of the lower lid. You just have to make sure the lower lid has good tone, or else you can get some change in lower lid shape that's unattractive. This is another good example of keeping that eye open, making it look bigger. The face is just more symmetric. And anytime you can optimize symmetry, you can optimize attractiveness. An excessively gummy smile comes from excess vertical elevation of the upper lip. So by relaxing the muscles that lift the upper lip, you can reduce the lip elevation and not see as much gum. And again, some people like this look, but for her, and in my opinion, in most patients, this look is preferred. Here's an example of both, where the eyes become slit-like and there's excess gum show. So here we've relaxed the lids and relaxed the elevators of the upper lip just to make her look that much more attractive. Sometimes, as I mentioned earlier, we can lift the brow. This is a good example of lifting the brow. So since Botox only does one job, and that is put muscle to sleep, the only way to get lifting is by reducing the depressor muscle, the muscle that pulls the brow down, while leaving some activity in the elevator muscles, the forehead muscles. So it's like a one-man tug of war, and the brow can lift up. Sometimes we want to drop a brow. This is a brow that's slightly higher on the right than the left. You can look at the difference in her lid platform. There's excess platform relative to this side. Symmetry is beauty. And in her case, I felt it was more realistic to lower this brow, improve lid symmetry and brow symmetry. Narrowing the lower face. Sometimes the lower face is a bit strong due to excess muscle in the jaw, the masseter muscle. It's a big square muscle laterally. And if it is from muscle, we can make that muscle atrophied with Botox. The nice thing is that atrophy lasts longer than typical Botox treatments, which are redone about every 4 months in my practice. I typically don't re-inject masseters until about 6 months. It takes some time for the muscle bulk to redevelop. Here's someone with both an elevated brow and strong masseter muscles. So we've softened the masseter, making her face less square, and lowered the brow, making her brows more symmetric and her forehead more relaxed. So as I alluded to earlier, faces de-volumize. You can see Boy George looking quite different. I mean, listen, there's no question that in both these cases, this is a pretty face, but that youthful fullness changes. The cheek drops, we flatten laterally. So fillers are intended not to make someone look artificially young. They're just intended to make people look as good as they can for the age that they're at. So I thought this would be helpful to you beneath the skin and in some places beneath the muscle, like here. We have distinct fat pads, and these fat pads atrophy with age. So the artist has joined a picture of a daughter and a mother. Their faces split, but he's trying to visualize artistically what accounts for the changes in their facial shape. And when I'm injecting fillers, I'm actually thinking about this anatomy. I'm reestablishing the lateral cheek fat pad, or the suborbicularis oculi fat, or the mid-cheek fat, or the marionette fat. So that is what I'm thinking about when I'm injecting. We also lose bone. Orbits get larger, cheekbones flatten, mandibles thin, chins less projected. All of that can be reestablished to some degree with injectable fillers as well. So our faces go from this sort of connected, beautiful, smooth cheek, lid, temple junction, no lines in the lower face, minimum nasolabial fold, clean jawline, everything is supported up and out, to loss of volume and a series of hills and valleys, the puffiness, and then the valley and the hill and the valley and the hill and the valley. And with that loss of cheek volume, the skin sags, we get that typical jowl and softening along the jawline, the depression in front of the jowl called the pre-jowl sulcus, and in many cases, the mouth begins to descend as well. So this is a very typical 64-year-old, and I'm never for a moment going to get this face to look like her daughter, but I will share with you that this guides me, and I very often find that looking at pictures of a patient when they're younger helps guide my aesthetic decision-making when I'm rejuvenating, whether it be with injectable fillers or surgical interventions. So this is a simple construct, the triangle of youth with lateral width and lower face tapering, and the inverted triangle as we get older. Here's a good series of faces that we're all familiar with. And you can see David Bowie's face is much heavier in the lower face. Tom Hanks lost that nice mid-face fullness of youth. And the Fonz, well, you know, he's gained some weight, but that mid-face is de-volumized and everything is sort of settled lower down. So injectable fillers replace lost fat and bone. They reestablish a more youthful facial shape. In essence, they flip the triangle and they create a more vibrant and healthy appearance. Now, when I'm injecting, I'm not only thinking about these fat pads, which are drawn as shown, but there are a number of nerves and vessels that every injector needs to be aware of. And injecting is a deceptively simple task where you're simply putting a needle into the skin and pushing in a gel-like product. But I can assure you that without proper training and knowledge, filling not only can be technically a failure, but artistically a failure as well. So it's very important that you choose injectors that have a great deal of experience and knowledge, because this is not something that should be considered a casual intervention. Now, whenever possible, my fillers are placed basically on the bone, just above the bone. There's a thin bone lining, and I'm really sitting on that bone lining. So I'm beneath the skin, the muscle, and the fat of the face. And the reason I do that is, first of all, it's a very safe plane. There are no vessels if you're on the bone, except for some very selected areas that you need to know about. It also optimizes the appearance of filler because you have this thick soft tissue envelope covering the filler. So the likelihood of irregularities is much, much lower. Fillers look soft, smooth, and very natural. And it's an anatomically quiet area. It's far away from the skin. Why is that important? Well, all the fillers I use today are made of hyaluronic acid. And hyaluronic acid fillers are mimicking the hyaluronic acid molecule that's found in the skin. Well, if it's manufactured in the skin, it also is broken down in the skin. The resident time for a hyaluronic molecule naturally in the skin is about 2 days, at which time it's broken down by hyaluronidase, the enzyme. Well, that hyaluronidase will break down these fillers as well. So I don't understand why many people inject under the skin, since it is adjacent to basically the factory where the hyaluronidase enzyme is manufactured. By placing it deep on the bone, you're far away from that enzyme. Also, you're below facial muscle movement. And we know from experience that if the fillers are placed deeply below facial movement, fillers tend to last much longer. So they last longer, they look natural, and it's a safe plane of injection. So everyone, I think appropriately so, is a little anxious, certainly before they've ever had fillers in the face, thinking about getting fillers in the face. Having a needle in your face is not something that most people would find comfortable in thinking about, but I will share with you, we are very focused on your comfort. It is critical that you maintain a relaxed posture, that you're not scrunching up your face or overly anxious, and making the entire experience difficult for yourself as well as difficult for us when we're injecting. So first and foremost, fillers have lidocaine. Every filler I use, whether it be Restylane, Voluma, Juvederm, Lift, doesn't really matter what it is, they all now contain lidocaine. So you're going to get numb as we're injecting. But the key is, how can you reduce the discomfort of having the needle pass through the skin? And that's what this device does. This is a cold roller. It stays in the freezer. It stays super cold. And by placing it on the skin immediately before injecting, you barely feel the needle enter the skin. And then once injected, the numbing medicine begins to work. Also, we use arnica, both orally and topically, as well as bromelain, to reduce post-treatment bruising. Today, we also use a laser. If you have bruising, we have the ability to use a Cutera V laser to break that bruising up and dramatically shorten recovery. It's actually quite a remarkable tool that many patients are now taking advantage of, usually 2 or 3 days after treatment, if you develop some excess of bruising. And of course, we're prepping your skin with all sorts of medicines to reduce any bacteria on the skin and making this a very sterile procedure. And of course, good technique is critical, making sure that the needle is clean and never touched. You'll see me often changing needles if it gets slightly dull. So technique matters a lot. Also, we have Pronox. Pronox is a nitrous oxide oxygen mixture. It's a 50-50 mixture. It's laughing gas. The difference between what you get at the dentist and what you get at my office is you control it. You decide how much you want to breathe in and out. And if you do a little, you get a little buzzed. If you do a lot, you can even fall asleep. And we've had people literally fall asleep. But it really reduces your anxiety. And if you're someone who gets anxious, this is a very useful tool. I was just informed that the Pronox company is making a new filter, which we are getting. We've ordered it in the new COVID-19 world. We have to be aware of filtering viruses. So we're just making sure that we're doing everything up to the standards in the community and even beyond to protect you. But just know that all of this tubing, all of the circuitry is discarded every time. So it's a single use. And if you come back 6 months later, you're going to get new tubing and everything's going to be brand new. So the likelihood or the risk of contamination is extremely low. It's a one-way circuit. Things flow only from the machine to you and then down this tube to the floor. So this does not return in any way to the machine. So it's a very safe technique. Also, you see me in full protective gear. This is my new look. So if you haven't seen me yet, in the last 6 weeks or so, this is what I wear. This is what my staff wears. Everyone in the office is doing this. We also, of course, will do a lot of other sanitization, and we'll talk more about that later at the end of the meeting. So what matters most when reshaping and rejuvenating a face with injectable fillers? Technique, artistry, and safety that results in a natural, beautiful, and long-lasting outcome. That really is to me, the sine qua non of excellent injectable filling. So just like the Hair Club of America president, I'm not just the president of the company, I'm also a client. Here I was at the age of 53, losing my mid-cheek fat pad. Mouth was starting to turn down. You can see my cheek was becoming concave. I was starting to have this cheek highlight, which is the bone, and this actually represents the height of my cheek when I was younger. So what I strive to do is to connect this line and this line. So filling in this valley and making this less sunken in will make me look healthier, more youthful, and even has the added bonus of pulling the corner of the mouth up ever so slightly. So you can see the contour looks just more connected. And that's just a beautiful, for me, a beautiful example of filler in the mid-face. So there I am actually doing it to myself, if you can believe it. I'll tell you the trick. The trick is that cold roller. Without the cold roller, it would be a task, I think, that would be too difficult for me, but I barely felt the needle going in. And then once I started injecting, of course, I got numb. So it's important for me to remind everyone, when I make a recommendation and I give someone a written quotation for what they're going to need to correct the problems that they've presented, very often people are taken aback by my recommendations. But remember, if I'm injecting deeply, it's going to take more filler to lift skin, muscle, and fat than it would if I was to inject within the skin or subcutaneously, which perhaps is the only drawback. But since fillers last so much longer, the value is really there. But I'd like to point out that it takes 5 syringes of filler to equal 1 teaspoon. Each syringe is 1 ml, and there are 5 mLs in a teaspoon. So here is the equivalent of a teaspoon of water. That would equal 5 syringes of filler. So when you're thinking 5 syringes, gee, that sounds like quite a bit, you have to keep the fact that the volumes are actually quite small in mind. So for those of you who've seen me in the office, I've certainly shown you this patient, but I think it's an excellent teaching example. This is a woman who came in and was getting a second opinion. She was told to have fat removed in her lower lids. That was her main concern. And I pointed out that though that was an issue, I felt that the fat was not the problem, which, by the way, this fat comes from inside the orbit. It cushions the eyeball and would require surgery to remove it. But I said, no, this represents the height of your cheek in your younger years. What your problem is volume loss throughout your entire cheek. So we really reestablished cheek volume. And here she is a year later, looking, I think, much more youthful and much better. You can see how we've reshaped her in profile. Really lifting that cheek forward helps rotate the skin and helps improve all of this. I did put a little filler here, but most of this improvement occurs from rotation. So this was at 1 year. Here she is at 2 years. At 2 years, I did a 2 syringe touch-up. Initially, by the way, I did about 15 syringes, about 7.5 syringes per side, though sometimes I'll do more on one side than the other. And at 2 years, she had a 2-syringe tweak, a little bit of voluma here in the cheek, which is what I use. By the way, all the fillers are made of hyaluronic acid. They're all chemically the same, but they're structurally different. They're manufactured differently. They have different characteristics. Some are stiffer, like voluma and lift. They're heavier lifters. Some are more granular, like Restylane, which stays put in areas where the skin and muscles are loosely attached. Others are very smooth, like Juvederm Ultra Plus, and they work well in the marionette and the lip. So I select different fillers for different locations based on their biomechanical characteristics, but chemically they're all identical, and they're all, by the way, reversible with hyaluronidase, which is very comforting, though very rarely called upon. It's very comforting to know that you can take them away, whether you didn't like them or have a reaction, which is extraordinarily rare. It's just good to know that you have that backdoor escape hatch. So as I said, here she is at 2 years. Now she's 79. Then she disappeared for 3 years. I didn't see her, and she came back. Now she's 82, and no one's touched this woman in 3 years, and she just has had 2 syringe touch-up in 5 years. At this visit, we did do a little bit more in her lateral cheeks. This was July of 2017, and she disappeared, as she often does, and reemerged in July of 2019, and now she's 84. So this is a great example where shape creates beauty. Shape creates that healthy, youthful look. Her neck is just as saggy. Her eyelids are just as saggy. So the sagging is not the issue. When you maintain mid-face volume, it feminizes a face and creates beauty. And I think this is a great example of beauty. So this is another construct. I think about this often. The egg, as we age, we get heaviness in our lower face. And really much of my day is spent flipping that egg, taking faces that are heavier in the lower and middle third and making it more in the middle and upper third, creating that nice youthful shape, makes the face look much more attractive. And here's a great example of that. This woman is attractive before, but naturally starting to get a little heavier in the lower face, a little flatness, a little hollowness. So this is just a month later, but to my eye, this looks narrower. This looks tapered. And the way that I created that illusion was by volumizing the temple and cheek. The temple is I think the most ignored area when injecting facial fillers. It's a critical area to address if need be to create that youthful shape and that fullness, that egg fullness in the upper to middle third, creating that tapering in the lower third. Here's another good example of that, flipping the egg. And this is another great example of just some fillers creating that mid-face dominance. We certainly didn't address every issue. There are lots of other things, and we didn't chase every bit of volume loss. That's not necessarily the goal. The goal is to do enough to make someone feel great, because it's all about personal confidence. That's the goal of facial aesthetics, not creating the perfect face. But I think this woman looks absolutely beautiful, and that mid-face dominance is really the key to that beauty. So enhancing facial balance. Remember, symmetry equals beauty. So this is not just a technique that we use in older individuals. This woman obviously is very young. She's in her early 20s. The thing that she didn't like was the squareness of her face. The thing that I didn't like was the flatness in her cheek, particularly on this side. She had no cheek highlight. And I didn't like this sort of hollowness and darkness under the eye. So our goal was to really create a more cherubic look, that egg. Think of that idealized facial shape, widening the cheek, filling the under eye tear trough area, creates that nice tapered lower face, and really dramatically changed her facial shape. Here's someone with just a subtle natural asymmetry. The jaw is different on the left and right. The cheeks are subtly different. And you can see we really rounded out this face, rounded out this jawline, and created a little bit more left-right balance. To this young lady's credit, she came in with those concerns. She diagnosed those issues, and we simply addressed them in a very slick, non-surgical way that got her on her way and back to life with really no downtime whatsoever. This woman presented unhappy with some lip injections that she had done elsewhere that classically overfilled upper lip. And I assured her that because they injected a hyaluronic acid filler, we can use hyaluronidase to reduce it and get that not as prominent. But I did point out that there were some other opportunities. I felt like she could use some strength in her cheekbone. There was an asymmetry in her jawbone. And overall, my goal was to improve left-right symmetry and put her lips into better balance, which you can see I think we've accomplished. Her cheeks are more balanced. She's got a nice cheek highlight. Her jaw is much more symmetric, and her lips are more proportionate. You always want that lower lip fuller than the upper lip, not the reverse. And you can see I even lowered and strengthened her jaw. I've improved the angle and really improved the entire jaw on that right side, the patient's right side, giving her that nice cheek highlight. But the connectivity, a cheek should be soft, full, and connected all the way to about the middle of the upper white lip. You should not see this skeletonized boniness to the cheek. So this is just a more youthful, more beautiful look. This patient, actually her main concern when I first met her, and again, she's a good observer, was this depression in the nose. She thought her nose was a bit sunken in right here. And I thought there was something to improve, and we did use some filler to address that. But I pointed out that this is her high cheek and this is her low cheek. And everyone has that, by the way. Look at where your earlobe inserts, and you'll see the earlobe on her, the left is higher and the right is lower. The lower side is always a bit flatter. So my goal was to raise the right cheek and then fill in the hollowness in her temple, which was dramatic. You do not see the full extent of her brow. Look where this brow stops. It stops right here, and you miss this entire tail of brow. So filling in the temple softened her midface, gave us a view of the full extent of her brow, and put her cheeks into more left-right symmetry. So she's a woman in her late 40s, and I would argue that, you know, she looks stunning. I think she's just a real natural beauty. She was beautiful here. She's just a little bit more symmetric, a little less sort of harsh, and a little softer, a little bit more feminine perhaps, and beautiful. This is a great example of a limited volume case where I made recommendations that exceeded what the patient wanted to do. So we found a happy medium and addressed the issues within the budget that she presented to us. Filling under the eye, in the cheek, and down in the marionette creases, you can see there's a softness to her face. I mean, there's no arguing that I'm picking very beautiful faces for a reason, because my work looks really the best with beauty as a natural starting point. But I would suggest to you that she looks a little less tired, a little bit perhaps more rested and youthful, but beautiful before, beautiful after. Similarly, there's an asymmetry here. This is her fuller, more connected cheek. This cheek is flatter. There's a deeper malar fold, more boniness to the cheek. So I'm never going to perfectly optimize left-right symmetry, but you can see there's a connectedness to the midface, and there's a softness to the cheek. You don't see that drop off in the cheek. And this side, again, we've actually raised the cheek a little. So her cheek highlights are a little bit more balanced. And again, I've stayed within her budget. This is a limited volume case. This is not executing everything that I wanted. But even within that limit, I think we created real enhancement. So say goodbye to that tired look. You know, we as human beings are programmed to interpret darkness and hollowness under the eye as tiredness. But of course, it's not. It's often just a genetic or age-related bone and or fat loss. We often, in lighter skinned people, can have a brownish or bluish discoloration as well, which makes things look even more sunken in. So for many of you, you recognize this person. She's near and dear to me. She's my surgical assistant, Desiree. She naturally has a higher right cheek and a lower, flatter left cheek. She's naturally a bit hollow under the eyes. So putting a little filler under the eyes and balancing her cheeks just makes her look even more beautiful. This is a former assistant, and she has that naturally dark, hollow, lower lid. But one of the other issues is her eyes are a little too close together. And I created an illusion. You can see her eyes look wider apart. The way I created that was I actually widened her whole face. And in so doing, it creates the illusion that her eyes rotate outward, which again is an artistic trick, which speaks to the fact that injecting is not a technical exercise alone. It's absolutely an expression of my artistic vision. I think of injecting as sculpting in clay, where you're adding to the face as opposed to removing, which would be like chiseling stone. And I would think more surgically in that way, where I'm actually removing excess sagging skin and tissue, where filling is more like sculpting in clay. Here's a great example of filling in that deep hollowness under the eyes. How much more beautiful do her eyes and mid-face look? It's just such a powerful intervention, and no more tired look. And similarly in men, I didn't do anything to the skin, but by restuffing that pillow, it just simply stretched the skin and made that eye area look less tired. I also widened his cheek just a little bit. So this whole zone has been connected, but on men, I don't want to give them such a strong cheek highlight, because my goal is not to feminize the face. My goal is to make the face look rejuvenated. Here, again, that tired look, that drawn mid-face, just makes it look so much brighter. Here's a 4-year follow-up under the eyes. I mean, look at that to that. People often comment that they liked the direction she went with her hair color, and I can't argue that point. But I do think that this is a beautiful example of the fact that fillers themselves stimulate collagen. So the filler may not even be there any longer, but it stimulates your own natural collagen, so you get some long-term benefits even once the filler is gone. This is 6-year follow-up. Look at how much better that area looks. Dramatic. Again, collagen formation. And this is 2-year follow-up. I mean, let's talk about transformation. Hair, makeup, earrings, beautiful blouse. This is a confident woman. This is a woman that comes in with that sort of nonverbal communication of, I love the way I look, and she's making a statement. This woman, I don't know if she loves herself in this picture. She's very lovely. She's a absolutely beautiful person, but I'm not so sure she was thinking that she would ever look so beautiful and youthful. But all I did was really reestablish mid-face dominance, and that really transformed the entire person. And I just love that about this photograph. So if you fill in the valley, the hill doesn't look as high. So let's see what I'm talking about. So I'm going to give you many examples. So I mentioned the puffiness of the lower lid. That's different than just being hollow. And by the way, that hollowness we call the tear trough, where the tears would run. But this puffiness, this comes from intraorbital fat. So this is two problems. This is fat bulging, and then the tear trough hollowness. So if you raise the valley, if you elevate the tear trough enough, you can minimize the visualization of that hill. So sometimes I can completely eliminate that. Sometimes I can't. But I never push fillers beyond what they should be doing. So for instance, this woman, I specifically chose because she has still a subtle bit of fullness here. So to get rid of that completely, we would need surgery to remove that excess fat. But I did as much filler as I could that I felt was aesthetically pleasing to soften that problem, but I think really created a beautiful mid-face lift. You can see this whole area is depleted, and she just looks just fantastic. And now her eyes pop. The mascara doesn't hurt either, but her eyes really grab me in this picture. Here's a great example of excess puffiness next to a depressed area or valley. Filling in the valley makes the puffiness less dominant. Similarly, we can come back and do other things. We can do some laser and so on to improve skin, but look at how much better she looks with just some filler. And even in younger patients, you can make that valley disappear and the hill look less dominant, so that puffiness is improved. And here's another great example where the puffiness is really dramatic and that valley is pretty deep. So the only thing I did was put filler in this area. I wanted to put some in her cheek, but she didn't allow me to. But I think, you know what, she looks amazing. And in men, same deal. You can see when you fill in that valley, that deep valley, that puffiness looks so much better. And he just doesn't look nearly as tired in this picture compared to that picture. Let's talk about lips. This is an area that I think a lot of people are interested in today, but they're fearful that lips are going to look unnatural. Well, to me, the lip posture and shape should always look natural. And that's really not negotiable. If lips look injected, the injector has failed. You failed to create the illusion that you want. A good illusionist fools you. You can't figure out how the trick is done. As an aesthetic surgeon, I think of myself as an illusionist. And if anyone can guess the trick, if anyone can look at someone and say, she looks good, but she looks like she's had X, Y, or Z done, then I failed. So lips, to me, should look natural. So this is a good example where lip posture is improved, not by lip injection, but by cheek injection. So just putting some in the cheeks restuffs this pillow and pulls the lip up. So I did nothing to her lips, just filled her cheeks, and at rest, she has a better resting posture. This woman, my focus was under the eye. She mentioned that she wanted a little bit of lip. So I like putting her in because I tell people this is about as big a lip as I'm going to ever create. And for her, with all of her fullness in her cheek and the natural beauty of her face, I think those lips really still fit her quite beautifully. But that's, I think, about the upper edge for me as to where I would want to go with a lip. Here's another good example. Some filler here in the cheek and the chin. But if we didn't do anything about the lips, the face, there would be just that something missing feel. So here is just a good example of, I think, lips that look natural, just a little bit fuller, a little bit plumper, but still match the rest of the face. Similarly, this is a good example. And I will point this out. You don't want the lower lip smaller than the upper lip. So here there's a much more natural balance to the lips. Here I think our upper lip is a little too dominant. I also raised the right cheek, put a little filler underneath her eyes. So I can just share with you, I think this is a really beautiful outcome, and everything is really subtle. Little lower lip, right cheek, and under the eyes. That is a great example of artistic injection. Here's the power of just a little lower lip. When you lose that lower lip and the upper lip's shape is still fine, just enough to create more balance, creates just a nice welcoming look to the face. Here's someone with a natural crossbite. The lip is uneven. So I didn't fix her teeth. I'm not a dentist, but I did fix the lip on this side. I fixed the lip here. I also did fix her jawline, that little pre-jowl dip, to make the jawline look more smooth and connected. So all of that's, again, just some filler. And if I didn't tell you that she had her lips done, I don't think anyone would guess. Enhancing chin projection improves neck contour. So this is just a month later. She didn't lose any weight. I just brought her chin forward a bit with some filler, and it makes that neck look better. Here's someone who is just naturally very deficient in her chin, and bringing that chin forward just helps that neck contour look even better. And this is a great example of improving a profile totally non-surgically. Similarly, just a little weakness in the chin, bring that chin forward, and look at the angle of her chin and neck. Look how much better it is just by bringing that chin forward. And similarly, this young lady, when she first presented, thought she might need some liposuction here. And I said, well, you may, but let's get that chin projection improved first. I suggested a surgical procedure. She did not want one. So we used filler instead of an implant. But here she is. And here's the same patient 4 years later. and the filler has never been touched up, so she's holding strong, and that's doing quite nicely. So for her, it's really worked out quite well. So next, let's talk about what I call rhinoplasty light. These are fillers. This is not surgery. So this is a woman I just treated just a few weeks ago. I haven't even seen her for her follow-up yet, but I did get a picture right after treatment. One of the issues is that she felt like they left her with a bump and then this dip right here. She just didn't like this part of her nose after the rhinoplasty that she had done elsewhere. And this is immediately after. You can see the nose is a bit red from my injections, but the profile has been straightened really in a matter of minutes, and that will last for years. This is a woman that had 2 rhinoplasties. This is really a terrible circumstance. She's just stunning. She's very tall and elegant, beautiful, beautiful woman, just with this terrible over-resected, really surgically traumatized nose. And she's nearly 6 feet tall. To give someone such a overly resected nose and a very tall person makes them look unnatural. Also, the whole tip looks very bulbous. So by raising the dorsum, this is all done non-surgically in the office in a matter of 15 minutes, can really transform someone. For someone who has a curved nose, injecting on the concave side gives the nose a straighter appearance. This is another good example. The nose takes a jog to her left, and here you can see it's just much straighter. This is a woman who had a rhinoplasty in Asia. This was actually an incision they used to break the bones in her nose, which is crazy to me. But she was depressed and asymmetric. Her nose was pushed in on this side. And here she's just much more balanced, and I filled in that scar a bit and worked on the nose. So all of this is done non-surgically, which is really fantastic. So to finish up, I just want to show you how fillers and surgery can be combined. I will say that for me, as I said earlier, fillers are beauty. And in almost all cases, fillers will play a role in any rejuvenation that I do. It's very rare that I do surgery only. It's not never, but it's uncommon. So here's a woman, and we had limited volumes to use. We had to stay in the office. We had to respect the budget that we were presented with. So this is a 2-year follow-up. We did upper eyelid surgery and a little filler underneath her eyes and cheeks. And that's all we did. But I would argue that she's just beautiful. She looks amazing. And I love this image. This woman originally said, I can't use her images. And by the way, all the patients that you're seeing tonight, I have permission to use their images. But I will tell you, after I did her work, she said, oh, you have to use my image. So I'm using her image. Upper lid surgery, some filler under the eyes and in the cheeks. And I think that was just a beautiful way to highlight her eyes, her mid-face. She just looked so much more feminine and beautiful. This woman, I did a tertiary rhinoplasty. She had had 2 previous rhinoplasties, excessively boxy tip. I'm not showing you her profile, but she had a divot in the profile. So I improved her tip aesthetic. I also did upper lid surgery. This is 2-year follow-up. But I think the thing that makes her so beautiful is this mid-face volume. See the way I've connected her cheek? She doesn't have the boniness and the depression. All of this, as well as a little bit down here, she looks just sort of buttoned up and not happy with herself. And here there's just a beauty that comes through, and you can really appreciate her beautiful eyes. This is an example of filler under the eyes, some laser around the eye, and a lower face and neck lift. So you can see the neck is improved, the jawline's improved. But that filler laser combination is just such a home run, and she's a great example of that. Here's another good example of that, where the fillers and the lasers work together. We did a lower face and neck lift. Her neck and jawline are looking great. You can see that there, but it's that youthful connected cheek and that really deep crease. I didn't think I'd be able to completely pop that, and I will share with you, there's some pretty significant hills and valleys here, but getting that smooth, soft, and connected just makes her look so much more beautiful and younger. Another good example, upper lid surgery, filler under the eyes, laser, and that just makes her look so beautiful. And in profile, obviously we did her neck, we did a lower face and neck lift to give her a better neck, jawline, contour. This woman is, she's, let's just say, an older woman who had a number of issues, and the things that are most obvious perhaps to you would be the loss of this wattle, which we dealt with through what's called a direct neck lift, which I'll be speaking about in 2 weeks, where we directly remove it. We use CO2 laser to completely resurface her skin, and you can see the dramatic skin changes. But I don't think any of this would look quite natural and beautiful if I didn't reshape her cheek. So her eye plane sits well forward, her cheek is well back. There's lots of undulations, hills, valleys, hills, valleys. So I reshaped her cheek with filler. This is 2-year follow-up, and that eye and cheek are now in plane. And now everything together makes her look fantastic. So I call this last slide Kitchen Confidential. I will tell you that I treated the next patient, who happens to be my dad, in my kitchen. This was actually the year before he passed away. And he really de-volumized in his 80th year. It's certainly possible that he had extensive cancer at that point. He ultimately did die of cancer, but the volume loss in his face was dramatic. Now this is a selfie. It's distorting his facial features. He did not have a nose that was that large. You can see it's more proportionate here, but look at the volume loss in his cheeks and under his eyes, and everything became almost like skin on bone, no fat whatsoever in his face. So I reinflated him in my kitchen, and this is my dad a year later. We were at my sister's house for a celebration, and I can just share with you that he was a very gregarious and outgoing guy, loved people, loved to flirt and chat, and he was a real performer. And when he reestablished more normal, more recognizable facial shape, it was a big emotional boost for him, and he let me know that he really appreciated it, and it was wonderful to be able to give him that gift. So the power of fillers is not to be underestimated. It's obviously going to improve one's appearance, but the emotional boost that one gets from looking better should never be underestimated. And during these difficult times that we're all living through, this unprecedented COVID crisis with really no end in sight, we should never forget that mental health and well-being and feeling good is critical, perhaps even more so now that we have all of these external stressors to concern ourselves with. So first and foremost, we are a healthcare practice, and our pledge to you is to protect your health and provide exceptional care. So I just wanted to go through the things we're currently doing. These are new procedures and policies that we have to institute. So if you're early to your appointment, we're going to ask that you wait in your car. When you come in, we're going to ask that you complete a quick form, just asking you routine things about fever, cough, travel, etc. We're taking temperatures of all staff and patients and making sure that no one has a fever. All patients are requested to use hand sanitizer upon arrival and checkout. If you do happen to see someone else in the office, either a staff member or someone else, please maintain a safe 6-foot distance, whether it be in the waiting room or in the hallways. We conduct proper surface disinfection after every single patient. Obviously, we're a medical practice and we're always trying to keep things clean, but we're taking it to a whole new level of sterilization and cleanliness. And as you saw me in the picture earlier, I'm wearing personal protective equipment, both for my safety as well as for your safety, because of course, when you're treated, you'll have your mask off. We encourage you and in fact implore you to wear a mask to the office. I think that's just good general practice for everyone. So for those of you who've made it to the end, thank you for joining our virtual beauty series. This is our first lecture. and we're happy to extend a 10% discount on an injectable filler and or Botox treatment with me. The treatment must be completed by Friday, July 31st, so it's about 2.5, almost 3 months from now. To reserve your discount, this is what we've done for all of our events since we've been doing them over the last 9 years. To reserve your discount, simply call the office, 770-425-7575, and place a $200 deposit by close of business Tuesday, May 12th, which is this coming Tuesday. So tomorrow, Monday or Tuesday, please call and put your deposit down. That'll lock in your discount. All deposits are non-refundable and non-transferable. However, if fillers and Botox, fillers and or Botox are performed after July 31st, you don't lose your money. The deposit retains its face value. It's just that the discount no longer applies. So if you're interested in taking advantage of either the Inject-Lift technique or straight up Botox or one of these two things, please take advantage of the discount. It makes a lot of sense. So what we're going to do now is I'm going to close out this portion of the meeting, and let's open it up for questions. Let's see here if I can do this. Oh, well, that's not working. All right. Here we are. All right. Please, Sheila, ask a question. All right, let's see if I can figure this out. Here we go. All right. So my first question is from Cynthia. Are you doing in-person consults or video only? I'm doing in-person consultations. I did 2 today. We are ramping back up in a very deliberate but slow and thoughtful manner. And you can just call the office and schedule an in-person consultation. I'm also doing virtual consults. I do the virtual consults on the days that I'm not in the office. Hopefully over the next several weeks, I'll return to a normal full schedule, 5 days a week in the office. But yes, we are doing both in-person and video consultations as well. Cost range. Heidi asks a question, cost range. So it's a very difficult question to answer, but I'm going to try to do it nonetheless. So on average, a person coming in their mid to late 40s, if they've done nothing with injectables, they're probably looking at anywhere between perhaps $2,000 and $4,000 in terms of injectable fillers. And that's a rough estimate. Some people less, some people more. If you're in your 50s, it's probably more along the lines of $5,000 to $6,000, $7,000. And if you're in your 60s and not wanting to do any surgeries and only sticking with fillers, it could go up as high as $10,000 or $12,000. It really just depends on what I'm trying to accomplish. But again, we work within budgets all the time. So there's an aspirational sort of quotation that we often provide. As an artist, I find it really hard to temper my enthusiasm. It's just a fact that you know, I see all the opportunities and I get excited about all of them. So it's just really difficult for me to not at least quote all of that. But for those who are not limited by budget, you know, it can get rather expensive. But for those who are on a budget, we find opportunities really for just about everyone. I can't say that it's true for everyone. Some people who need, let's say, $10,000 worth of filling and have a budget of $1,000, I'm not touching that person. But if I recommend 5 and you can do 2, I think we can probably work together. Sheila asks, how do we know if we need this? So there's really only one way, and that is for either myself or Jennifer Lichty or Kelly Human to have a consultation and look at you. For many patients, it's a consultation and treatment combined. So certainly for patients that have had treatment by me in the past, the patients are well known to me. They're familiar with the process. So they'll come in and they'll say, I don't know what I want, but I know I'm not happy. Make your recommendations. And we'll make our recommendations, and either they'll do that full plan right away, or they'll do part of that plan and then come back at some future date and complete it. But you know, it's a quick consult and treat. For those that have never met me, we can simply have a formal consultation without a treatment, because it's always difficult. One of the challenges with this tool is it's a black box for patients. They don't know what they need. They don't know what I'm going to recommend. They have no idea about cost. And quite frankly, until I see you, I have no idea about cost. So it's very different than buying a car, where we can do our research online and pretty much know what we're going to spend. So by no means should anyone feel guilty coming in just for a consultation and not doing anything. It's not right for everyone, but I can just share with you that I'm going to work really hard to find a place to intervene and make you feel great, because it's ultimately not about creating perfect anything. It's not about creating the perfect look or the perfect face or the perfect result. It's about making enough change to make that person feel great and happy. And I'm very value driven. To me, value means you've spent some amount of money, and it doesn't have to be a small amount of money, but some amount of money, and then you're getting a result. And at the end of the day, you're saying that was money well spent. If you feel like it's money well spent, then that's good value. Let's see, clarification. Inject-Lift's a technique, correct? You use Juvederm, Botox, etc. Yeah, so Inject-Lift to me is a concept just as much as a technique. So I will share with you, I had the privilege of traveling to Italy and visiting some of the museums in Florence, and we had a tour guide who said that Michelangelo had no assistants because he could never teach someone how to see like Michelangelo. And therefore, all the work that you see from Michelangelo was done by his hand. And for a very long time, I felt the same way. It was difficult for me to convey my vision of the changes I wanted to create, and how I was able to sort of create those changes started with my vision. But then after years of teaching at Emory and teaching more than 50 residents, I worked through and developed a way of analyzing faces that I didn't get into tonight, but it's very unique, it's very detailed, it's very numbers driven, it's very measured, and it's very complete. And that has helped me communicate, because I can teach people how to assess faces in a very formalized way, and then teach them where the opportunities are, and then teach them how to achieve the results. So Inject-Lift is a technique of assessing faces, of three-dimensionally reshaping faces, improving left-right symmetry and proportionality, and creating the change in a way that looks very natural and is very long-lasting. So in a sense, it's a technique that's a refinement of other techniques, and that's how I think about it. I hope that helped, Cynthia. Susan asks, if I pay the $200 deposit for Inject-Lift, but you determine through my consultation that another procedure is needed, or that Inject-Lift won't work for me, can the $200 be used for another procedure or product? So yeah, of course, I'm not interested in taking $200 for services not provided. That's ridiculous. The whole point of this is just to have some level of commitment and provide a discount for services that we hope will be appropriate. I can only say, Susan, that it's the rare face over 40 that cannot benefit at all from volume placed somewhere. And filler injectable syringes range in price from $650 for Restylane to $1,050 per syringe for Voluma, which is the most expensive filler that we use. Oh, and each Botox treatment, by the way, I'm an area guy. I charge by the area. I do not charge by the unit for Botox. I think that unit pricing is fraught with potential for fraud and deception, and I just don't want to have that that perception in any way, shape, or form. So I charge $390 per area: forehead, glabella, crow's feet, perioral, one masseter and one masseter. Those are each an area. And I will use as much as I need to get the job done. So $390 is a single area Botox. So $200 is below the cost of any one treatment. So it would be extraordinarily unusual, Susan, to have no opportunity for volume. But of course, if that was the case and you came in and it was not appropriate, then we would of course apply it to some other technique. So yeah, that's the answer. Let's see. Kathy asks, you're doing the blepharoplasty webinar on June 4th. I'm interested in having that done plus injectables. Will there be discounts on the blepharoplasty during the webinar? Yes, so my plan is to offer discounts for each procedure or the procedures that I'm discussing in that webinar. So the answer is yes, Kathy, there will be discounts for blepharoplasty in that presentation. All right. Jane asks, I'm already scheduled for a consult with you later this month. When I called to schedule my appointment, there was no discount options. I did pay the $100 deposit and was told that would come off the cost of any procedure. Would I now be eligible for the 10% if I call the number you provided? I'm excited, looking forward to seeing you in a couple of weeks. Yeah, so I literally just came up with this discount slide today. When I was finishing my presentation, I had not exactly decided what I was going to do. The process has always been the same, but what we're discounting and how much and so on is variable. So for instance, in the future, if I wanted to, when I offer a blepharoplasty discount, the same type of thing will apply. The $200 will go towards that discount, etc. Yeah, you're only going to be charged for a consultation if you get a consultation and never do anything with me. But if you have a consultation and then do anything at all within my recommendation, we're going to take that consultation fee right off the top. So that consultation becomes free. And if you call in the next 3 days and put down a $200 deposit towards the Inject-Lift, remember, oh, I didn't do my last little thing. The discount code is Inject-Lift Virtual Beauty Series. Don't worry about it. We've got it figured out. Nothing else is being called in for discounts through Tuesday, so you're good. You don't have to worry. But the Inject-Lift discount will be applicable to you. So you'll get the free consult if you do anything, and then if you've had your deposit down and you get fillers, you'll get the 10% off the fillers as well. So yes. All right. Looks like that's it. Those are all good questions. And the hour is late. So I hope that everyone stays well and healthy. I hope you all learned something. I love teaching. I love doing these webinars. I miss all of you. Can't wait to get back into the swing of things, though I will say wearing that N95 mask all day is tough. it's uncomfortable, and unfortunately it's my new reality. So if I don't shake your hand, or I don't show you my face, it's not like I'm being rude. I'm just trying to be courteous and to protect you. So I hope to see all of you in the future. Stay well, stay safe. Bye-bye.